But let's go ahead and kind of just repeat a few of those. Blood cancer is actually an umbrella term for several different forms of cancer. How does this work? And kind of give me the rundown of Blood Cancer Day, since today is World Blood Cancer Day.
Yeah, I think that it's just sort of there to raise awareness. As I mentioned earlier, it's in the terms of in general incidence, it's relatively rare. I mean, cancer in general is pretty rare overall. And so in the realm of cancer, it only accounts for about 10% of cancer. So it makes up a small portion of the patients that we treat as oncologists.
Well, so how common is blood cancer? Until today, I didn't really know what blood cancer
Yeah,
was. And my
yeah.
co-host, Hannah Fletcher, was just like, hey, it's actually really common. So how common is blood cancer?
Yeah, I mean, I'm a hematologist, so I focus mostly on blood cancer, so I see a lot of it. But I think if you look at statistics, like I said, it accounts for only 10% of cancer diagnoses. So in that world, it's pretty rare. I think strictly speaking, about 1.5 million patients actively have a diagnosis of a blood cancer, and I believe it's diagnosed. Someone's diagnosed with a blood cancer approximately every 3 minutes. So it's certainly lung cancer, colon cancer, things like that are much more common. But as an oncologist, I do see a lot of blood cancers.
Well, how does it compare to other cancers in terms of diagnosis, treatment, and fatality rates? Is there any sort of, I guess, connection in between the two?
Yeah, not really. I mean, so blood cancers. Let's talk about leukemias for a second. Those start in the bone marrow, and so symptoms can vary pretty widely. The main symptoms to be aware of for a leukemia, for example, would be low blood counts, low hemoglobin, low platelets, and that can manifest as in a few different ways. Fatigue, generalized weakness, chest pain, shortness of breath, lightheadedness, dizziness. Those are all symptoms of anemia. Low platelets, those are little cells responsible for forming blood clots and preventing yourself from bleeding out. When those are really low, patients can have issues with spontaneous bruising, easy bleeding, like bleeding gums, nosebleeds, blood in the urine, or even these little blood blisters, little like tiny red dots, usually in dependent areas kind of around the ankle, called petechiae. And those are all signs that maybe something is going wrong in the bone marrow. Like other cancers where you kind of go in and get routine scans for like low dose screening scans for lung cancer or colonoscopies, for example, or even skin exams for solid tumors like melanoma or skin cancers. You have usually a pretty good chance of visually laying eyes on a tumor or a cancer. And that's not always the case with blood cancers, except for the case of lymphomas, in which patients can have lymph nodes in their neck, their armpit, or their groin, which may be enlarging and causing symptoms. They may have an enlarged spleen, which causes early satiety or some abdominal pain or fullness. Patients may have B symptoms, which is basically unexplained fevers, drenching night sweats, or unintentional weight loss. So as you see, a lot of the symptoms are really non-specific, and there's a lot of overlap there, and it requires a pretty high index of suspicion to sort of go looking for those.
Yeah, when you talk about some of those, I guess, like things that you might be able to pick out about some of the people that might have blood cancer, it is kind of something where you're like, oh man, those red dots, or my gums are bleeding, those sorts of things. Is
Yeah.
there anything to be specifically worried about? What is one of the symptoms that's most common with blood cancer?
Yeah, most common is and it's going to vary very widely. The prognosis, you kind of alluded to this earlier, the prognosis for blood cancer can vary from something immediately life-threatening, which is the case for like an acute myeloid leukemia or acute lymphoid leukemia, or even an aggressive lymphoma like DLBCL or Burkitt's lymphoma, all the way to not probably ever life-threatening for conditions now called CLL, or chronic lymphocytic leukemia, or CML, chronic myeloid leukemia. But again, the symptoms, the things that I most commonly see that a patient's referred to me for, that it sort of sets my alarms off, is going to be they had a scan done for a different reason, which showed they had some lymph nodes that were enlarged. Or they went into their PCP, they were saying, hey, you know what, I've been really tired for the last couple of weeks. And they get a routine CBC, or complete blood count, done, and it shows that their hemoglobin is down to 7 or 8, whereas it was normal at 14 just 6 months ago, or things like that.
Yeah, it's just kind of interesting to see because usually, when you think of leukemia or breast cancer, one of my family members actually had breast cancer and she started to lose some of her hair. So you see some of those symptoms and you're like, how do these relate? And so that's why I asked that because some might relate. It really just depends. So what can people do to help those with blood cancer?
Yeah, those are that's a really good question. I mean, I think two of the big things to do is donate blood. Okay, so when you donate blood, you typically donate whole blood, and that is useful for a variety of reasons. Patients who have blood cancers who are getting high doses of chemotherapy, they're going to run into issues where their platelets or their hemoglobin can drop even lower, and they need transfusions of blood, transfusions of platelets, and sometimes even plasma derivatives like cryoprecipitate or FFP. So donating blood is definitely a help for managing these things. Another thing they can do is register to be a bone marrow donor in a registry called Be the Match. And so oftentimes allogeneic stem cell transplant is used in the treatment of some of these leukemias, for example, and putting yourself out there in the database as a possible donor for someone who might need that bone marrow transplant can save a life.
Definitely. So, Dr. Clark, is there anything that I have kind of missed talking about, obviously, World Blood Cancer Day, but getting to know a little bit more about this umbrella term for the cancerous growth in the blood, bone marrow, or lymph nodes? Is there anything specific that we can kind of tell our viewers to understand exactly what this is?
No, I think that it's kind of like we've already kind of alluded to. It's an umbrella term. It's not specific for any one type of blood cancer. It's a very wide range. For example, if you look at lymphomas, I mean, there are over 100 different types of lymphomas. And so it's an encompassing term that applies to a bunch of different types of blood cancers. And the way you diagnose, the way you treat them, and the overall prognosis can vary very, very much. Like I said, from something immediately life-threatening to something that may never cause any issues or problems at all, and they may never require any treatment. I think it just requires a heightened suspicion from the individual to sort of seek care if they notice any of these symptoms that are persistent or that are otherwise unusual.
Definitely. Well, Dr. Clark, is there anything else that you might want to add? I don't really have any more questions, but if you do want to add on something specific to kind of help our viewers in some way, somehow, that would be awesome.
No, just to reiterate, visit the local blood bank, donate some blood, and register in the Be the Match registry. That literally can save somebody's life.
Definitely. Well, Dr. Clark, thank you so much for joining us here tonight and giving us a little bit more insight into World Blood Cancer Day. It was a privilege to talk to you here on East Texas Now, and I hope you have a fantastic night.
Yeah, thanks for having me.
All right. All right, everyone. With that being said, we are going to go ahead and take a very short break. Thanks for watching East Texas Now. Sometimes it likes to be a little fidgety. All right. Bye-bye.